Good morning, Hong Kong. Welcome back to another episode of Hong Kong Insurance 101. This week, we're going to be doing something slightly different. We're not going to be talking about anything strictly insurance related, but we are going to be taking a look at the COVID-19 situation. The coronavirus is taking its toll worldwide, and a recent spike in Hong Kong cases has seen the government take further action to restrict cross-border movement and social interactions. This has been especially needed due to the recent case clusters in the city's main nightlife districts, specifically Lan Kwai Fong. One of the main news stories in relation to COVID-19 over the last week is how we should be, both as a society and more specifically those in the healthcare field, be treating the virus. This is a fairly complicated issue, as social distancing is seen to be the most effective way to slow the spread of the disease in light of the fact that there are currently no proven treatments, cures, or vaccines for the coronavirus. We would urge our viewers to not try homebrew remedies, no matter who recommends the medication. If you are not being prescribed a treatment through a doctor or medical expert, then it is likely that the cure could be worse than the disease. As in the case this week of the man in the USA who died taking an unproven drug cocktail to try and address his fear of the virus. Now, researchers and scientists around the world are racing to try and find a vaccine against COVID-19. But in the meantime, palliative care as an inpatient is the main course of treatment for people suffering from the most severe symptoms of this disease. Inpatient treatment for COVID-19 entails respirators and ventilators to address the pneumonia symptoms and sustaining the patient's life with additional medical technology. However, the WHO over the last week has identified some drug treatments which may, and we need to repeat this, may be effective in dealing with the disease. A drug pre-approved for treating Ebola and a two-drug cocktail for treating HIV have been found to have some promise. Additionally, one anti-malaria drug has also been included into the global trials to try and fight the pandemic currently being experienced across the world. Despite this, no medications, as yet, have been able to target COVID-19 effectively. While the malaria medication did stop replication of the COVID-19 virus, malaria is a fundamentally different disease to the coronavirus. Malaria is a parasite, not a virus. This brings the efficacy of the malaria drug into question and means that patients should not take this medication without their doctor's approval. At present, the best way to fight COVID-19 is through isolation, social distancing, and good hygiene habits, like washing your hands regularly and not touching your face. In light of this, to protect both our own employees and our clients, CCW Global has instituted a work from home arrangement this week. We will be operating a skeleton crew in the office and will still be available to answer any questions you have in regards to your insurance coverage and the pandemic situation. But not all staff will be in our office at any given time. Phone numbers and emails will still be operational. We will continue to provide updates to you as and when we have them on this evolving situation. Otherwise, that's us for this week. Please stay safe and healthy. There will be no video next week as I'm taking annual leave, but be sure to like and subscribe to stay current with all our content as it comes out. And as always, don't forget to ask CCW. We're simplifying your insurance.